Good afternoon, everyone, and thank you for coming. My name is Leah Idelson, and I am a strategic partner manager for health at Meta. And I'm really excited to be here today to facilitate our panel conversation about Meta, KFF, and Bloomberg School of Public Health's partnership in addressing COVID information on our platforms. And so looking forward to our conversation. And Nick, maybe we'll start with you. So would love to have you take us back to March 2020, unfortunately. And can you tell us what was going on at the Bloomberg School and how you began creating content about COVID?
Sure, certainly. So going a little further back to January of that year, which probably none of us really want to do, we were doing business as usual, just like every other institution of higher ed in the country. We were using Twitter to share news releases about nutrition and injury prevention. We were using Facebook to talk about events on campus, Instagram sharing photos of students. But we were hearing more and more from our public health faculty about this pneumonia-like illness that was spreading throughout mainland China at the time and was starting to appear elsewhere. And we also knew that across town, our colleague Lauren Gardner and her team was launching this map, which Johns Hopkins tracking map became one of the go-to resources for the entire pandemic. And that stood up early January. It got more and more attraction throughout February, and by March, all of a sudden, everything closed down. We could not do our business as usual programming in our team for communications anymore. There were no events on campus. We couldn't use archival photos because students weren't wearing masks. We couldn't share news releases about our other public health programming and expertise because it just felt discordant with the moment. So very quickly we realized, this is a time to pivot, and what we pivoted to was pretty radical for a college to do at the time. We stopped talking about ourselves. We started talking about what our own faculty were saying. We have the world's leading virologists, molecular biologists, we have epidemiologists, et cetera, in the school. What were they telling their neighbors? What were they talking about on their listservs? And can we translate that for the public at a time when, frankly, I'll use the word inconsistent, there was an inconsistent level of messaging from the federal level about what to do about the pandemic. And we leveraged that trust. We had this map, which people saw. They knew Johns Hopkins knew about the virus. And so what could we as a school kind of say about that?
Well, I remember looking to Hopkins for information at that time, so thank you for all of that work. And Tina, curious to hear from you, how did KFF enter into the work of COVID?
So we are a nonprofit health organization. We're focused on the pressing health issues facing the nation, so COVID was a given. And we addressed it early on across our program areas, including policy analysis, polling, journalism, and the program I run, social impact media. And from the vantage point of what I was doing, we were really interested in how we were going to get information out to people who needed it. Our history and our work has been focused in the HIV space, so we knew how the COVID story was going to unfold, unfortunately, pretty early on, meaning the disparities that we were going to see in terms of populations most affected and most vulnerable to COVID, Black and brown populations specifically, who are the focus of a lot of our work in HIV and where we've built relationships over the years. So we looked at some of our experiences in that field. We knew that as exciting as the vaccines were going to be, science alone was not going to end this epidemic. We were going to need information and resources. We were also doing a tremendous amount of polling throughout the pandemic that has continued to sort of track where the public was. So we had access to a wealth of information about what our communities needed to know. I think yesterday somebody used the phrase learning opportunities instead of information gaps, and I think that's a great way to talk about it. We saw a lot of learning opportunities for all of us, but especially in communities of color. And we set out to try and address those and provide information. Our research also told us, and was known to us from our HIV work, that who our communities trust most is healthcare workers. To answer these questions, we teamed with Dr. Rhea Boyd, who you can see on the screen, to create a campaign called The Conversation, which featured healthcare workers of color from a range of backgrounds, physicians, nurses, community health workers and promotoras, researchers, midwives, to respond to the questions that we were hearing from the community. And over the next 2 years, we launched in March 2021 with that campaign. We've produced more than 350 videos with 32 healthcare workers of color, and we're going to talk more about it.
Thanks, Tina. Lu-Chen, Meta is not necessarily who we might expect to be the third speaker in this panel. Can you talk to us about Meta's role in this work and how Meta connected to Bloomberg School and KFF?
Yeah, it's pretty obvious. We are a little bit of the odd man out here. I think one of the things that's really important to start with is, I'll go back to COVID, but Meta at our core is about connecting people with the things that they care about in their communities. And this has actually been really core to the platform for years. I know many people in this audience have probably been in a Facebook group at some point. We've seen people connect in support groups on everything from trying to figure out how to help a family member through a cancer treatment journey, to new moms joining a Facebook group as they navigate, honestly, the fourth trimester. And so that has always been at our core, and we've actually developed products. We've been building public health products for the last 6 years. A product that we launched early on was a blood donations product, and it allowed people to connect with their local blood banks and donation centers. And it's a very simple product, right? It's like, it came actually from looking at communities, and specifically we had looked at what people in India were doing of, as they had family members who needed blood, they would immediately leverage their Facebook networks and try and find someone that would be able to donate for their family member in need. So we took that and we were like, great, the platform's perfect for that. We can connect you with a local blood bank or donation center. You can stay connected to them. You can book an appointment. You can get updates. And so that was a little bit of the beginning of our health journey over 6 years ago. When we launched that product in the US, we actually saw a 19% increase in US blood donors for the first time blood donors. So you think about that, that's an amazing impact. Now, if you fast forward to COVID, right, so a couple of years later from that, we knew that we weren't going to be in a situation of building a product for COVID. People were already using the platform to connect. I mean, I'm pretty sure everyone here at some point was on Facebook or Instagram or WhatsApp, connecting with family and friends, looking at content, trying to decipher next steps for yourself. And so, we actually started to think a little bit of like, okay, we're not going to build a product here. What we really need to start thinking about is how do we leverage this platform of these products that reach over half of the world with relevant information, access to reliable, relevant information that they can rely on and take action on. And so what that ended up happening is we started to look across, and this is kind of how we stumbled a little bit into this partnership, is we were like, okay, who are the people that have good content out on the platform, that it's accurate, that it's reliable, that it's speaking to the population that we have on the platform? And so we looked at, specifically Bloomberg School of Public Health. We're like, okay, they're accurate, right? And they can distill content down to a way where individuals can understand it and know what action to take. Similarly, we looked at KFF and we were like, okay, the program and just what Tina talked about is like the way that they're talking about content and making sure that it's relevant to all different types of communities, that's incredibly important. So when we started to look as we got closer to vaccination, we knew we were like, we are going to have a role to play. And that role is going to be making sure that we can get people one step closer to vaccination. So we've got to find the right content, we've got to work with the right partners to get that content out on the platform so we know that we're taking our part. And so that's really how it started. It's a 6-year progression, but I will say like where we are now is these types of partnerships have just been really a great way of seeing what the power of the platform can be and really what the power of connecting people and helping them build communities can do.
So Nick, as someone who was a primary partner to Meta in this work and who was disseminating amazing content that was accurate and distilled down to the core, what did you learn from this experience?
Yeah, so quickly we had to pivot to away from a photo strategy. So we couldn't use any photos, as I mentioned before, and that naturally sort of fed into a strategy of let's do a lot of graphics and illustrations. And you can only cartoon for so long, frankly, before you start dialing up the dimmer switch of humor on a lot of that. But what we did learn, and which I think is a valuable lesson for everybody here when talking about any social network, is we had success by individualizing the content. It's not always the case in public health, but it is sometimes the case that there are individual actions that add up to a population health benefit. And in the context of COVID, that started out as, wear a mask. And so what we did was we would begin with an overarching message about, our faculty. We would meet quarterly and come up with maybe 5 or 6 messages of this type, like wear a mask, stay, home if you can, et cetera. From there, you could imagine a segmentation where, okay, wear a mask to protect myself, wear a mask to protect others. You divide it even more. You start imagining like the broom scene in Fantasia, where those sub-messages divide now into the message that you're going to give directly to the vulnerable person. Maybe you're going to do that in Spanish. Maybe you're going to do one around holiday time, et cetera. And very quickly, you come from one message to 30 pieces of content that are distinct. And what we did with the humor aspect, it sounds, just a little weird when you're talking about an infectious disease, but think through who's actually following a health department page. Think through who is actually engaging with a school of public health at the time of a pandemic. And it's people who are overall pretty in line with our recommendations already. So we viewed our content as what can we make that they want to share within their networks. And in order to do that, we had to take this approach of, playing with people's expectations, et cetera. And what ends up happening is actually, we know this through measurement with Meta, is that the content that we posted that was shareable performed much better than the content that was strictly informational. And when you do that, we're actually fulfilling the public health goal of, we are a trusted messenger as Johns Hopkins in the context of the pandemic because we have the map. But someone who shares our content, their uncle is seeing them share it, and that person is the intermediary trusted messenger, and they're taking, they're more likely to agree with their connection than with us as a cold caller. And so fast forward to when we started broadcasting our content further and targeting to specific audiences using the data harnessed from the map. We knew where vaccine coverage was low, we knew where case rates were high. We were able to start equipping those trusted messengers with the resources they need to have conversations offline with the people who need to hear it. Some of our most successful content was how to talk to your friends and family about getting vaccinated, where we would equip people with what they needed to go have that dinner table conversation. What's interesting about all of this is that we saw similar rates of shares on that content even after we boosted it. And the other thing is we really understood that when you are empowering your audience to become the ambassador or the messenger on your behalf, the response from the person's family member is better than if we were to just target that family member ourselves. The analogy I use all the time is, it's if you have a megaphone and you're just noisy, you're annoying. But if you're playing a song people like, they might actually listen to it. And so that's sort of how we approached.
I love that analogy because it really speaks to the influence of trusted messengers. And Tina, your content was extremely different from the Bloomberg schools, but extremely effective as well, and possibly leveraging that same strategy. Can you tell us more about KFF's strategy and what you learned?
Yeah, absolutely. And not surprisingly, a lot of parallels, I think, in what we saw work. I mean, first, I would say, to echo what Lucien said, the power of partnership is just so critical in this. It began with the partnership with Dr. Boyd, with the healthcare workers who appeared in our campaign, who were not just messengers, but were real partners in creating that content. We did not script them. We had information about messaging needs that we shared and worked with them to get out, but we let them talk in their own voice, use language that they would use in talking to their own family members, with patients, sort of trying to give our community access to the people they wanted to hear from, experts who had the knowledge, who came from their communities in a way that they could relate to, who may not have access to that physician, and certainly not at that time when everybody was beginning to understand it. We also had partnerships that were crucial to getting it out. The best campaign in the world is nothing if nobody sees it. So, to have Meta and our other media partners step in and help us get this messaging out to people who needed to hear it in ways that they could access it, where they already were, was really critical. It's why we're here today, talking about it. It's sort of what the campaign built on to do. We were also fortunate to have a coalition of funding partners that came together early and helped support and give us resources to help launch and grow this, which was really imperative. And we had health departments that were working with us and community partners that amplified the messages out there. We make all of our content available rights-free. It's designed to be shared so that it can be used, as Nick said. We want people sharing it with the other people in their lives. We had it shared with physicians were using it to model their conversations. Health departments integrated it into their messaging. HHS ended up using content as part of their We Can Do This campaign. We wanted it out as widely as possible, and we created a campaign that was designed to be distributed in that way. And then the other big point is just sustainability. You've got to stick with it. And I think to the credit of all of us here, we were there from the beginning and we wrote it out. We've been doing messaging as recently as December. The conversation evolved to meet the needs as they moved forward, including now talking about boosters and the changing pandemic and where people were with confidence. Messaging gets harder as we have all hit COVID fatigue. Meta's been great about helping us think about how to strategize, how to present our creative, and how to evolve that so that it captured people's attention and met them in the moment. So I think those are some of the bigger things that we saw.
So Lu-Chen, how did Meta help these partners, and what was Meta's role in this work?
Yeah, I think our role was actually pretty simple. It was three things. So the first thing, it was budget. That is, we gave over $100 million in ad credits in 2021, specifically around COVID behaviors and vaccine confidence. And part of that was KFF and Bloomberg School of Public Health within that. So that's the first thing. But budget is actually a little bit of the easy thing when you think about it. The second thing we did is we actually gave a lot of platform expertise. So one of the things that we thought was really important was, making sure that we were pairing and giving support from within Meta to, think about some of the campaign dynamics as you were setting up the campaigns. Think of it as the producer and traffic control. The third one, which I think is the most important, and this is actually the one which this is kind of the testament to the work and the thing we want to see carry on, was measurement. Because honestly, what good is $100 million if you can't measure it and actually measure the real world impact of it? And so one of the things that we did is going back, so again, we're using our ads platform here. And one thing that we have within our ads platform is we have a way of measuring. We call it brand lift measurement, but it's something that has been used in the advertising industry for the last 15 years within digital advertising. And it's quite simple. It was something that we had actually given to our retail advertisers across the platform for years. And it's a way of basically being able to, it's a very simple test and control model, right? You have an audience, you define the audience, and then we split that audience into an A and a B group. One part of the audience, maybe the A group, doesn't get the ad. The other one gets the ad. You then pull them at the end of it, and you get those survey results, and then you're able to measure the percentage of lift. Very simple. Now, normally for advertisers, what we did is we would measure things like ad recall, brand awareness, sentiment. Now, when we brought it to the idea of measuring public health campaigns, we were like, okay, well, that's not going to work. We just have to actually rethink about those poll questions. The same methodology works. It's still set up once the campaign starts, but we actually have to think about poll questions that look at knowledge, right? So what was the knowledge gained? What were the behavior changes? And you think about those types of things and the attitude changes, and you put that into a poll, and at the end of it, you can actually start to measure the percentage of lift that is driven to influence. So I've changed you towards a positive behavior or positive knowledge from that ad campaign. And that actually was one of the really big learnings that we had from this, was you could take something that was tried and true measurement for advertisers for years, something that's off the shelf, anyone can use it in this audience, and then you actually bring it into a public health context and you're like, wait a second, like we've unlocked something here. And so, one thing I just want to actually talk through is I have a stat here. So I will go through what we learned from Bloomberg School of Public Health and KFF, but a couple of months ago, it was published in the Proceedings of the National Academy of Sciences of the US, right? Peer-reviewed journal. And they worked with us, they took all of the brand lift that had been running over the last couple of years, and they looked at over 370 advertising campaigns from 174 public health organizations. That is a large sample size. And they were trying to understand, they took all of these results of like, okay, what was the cost of influence? What did we actually get to? So you have that percentage of lift, but you want to figure out how effective was this? How repeatable is this? And they found out of all those campaigns, the cost of influence towards a positive behavior is $3.41 across the board. That's kind of amazing, right, if you think about it. Now, when you look at the example of Bloomberg School of Public Health and KFF, so between the two of them, we had 7 out of 8 of those brand lift studies with them were statistically significant. And they actually had a range of support or a range of influence of between $1 to less than $3.15, right? So you think about that, that's better than that average that was reported in that journal. So first, round of applause for KFF and Bloomberg School of Public Health. Well done, of really showing that you can exceed the average. But again, you think about it and you're like, oh, okay, we know the campaigns can work. We have a way of continuing to measure. There's really something there, and we can actually go back and say, we've had impact.
And Lu-Chen, can you tell us a little bit more about what that impact was and the success of the campaigns, specifically related to last summer?
Yeah, I think the big thing that we kind of came away with is a lot of us look at, even the way we just started the conversation of I'm so sorry, we're going to take you back to COVID for a second. I know we're all trying to leap that over here. We think of COVID learnings and insights as being something that is an anomaly. It was just a moment. It's not repeatable, and we hear it all the time. It's not repeatable. There'll never be another current event like this. We're never gonna, and fingers crossed, right? But one thing I'm concerned about, and I think is the call to action for a lot of us here, is okay, how can we take these learnings, things like these measurement findings, and now how can we actually take it and apply it to other areas that we care about within public health, right? So you think and you start to go through of I'm sure by a show of hands in here, how many of you have had to do social behavioral change campaigns and thought about that in a specific health topic where this could be applicable? It could be in mental health, be in youth and well-being, it can be in sexual wellness. The list goes on and on. So how do we take these learnings and how do we continue to apply them forward when we now have a very, I wouldn't say, I'm so scared of using the word novel because every time I hear novel, it's like PTSD a little bit. But we have a way of thinking about it and a way of measuring that we can move forward that can really have an impact.
And I want to double down on that piece just a little bit. So when last summer, Meta worked with KFF and the Bloomberg School to segment different audiences across the country and to target them with different pieces of health information based on that audience, based on those audiences. And through our measurement, and you heard Lu-Chen mention the 7 out of 8 of those tests that we ran just in last summer alone, we were also able to reach over half of all US adults with this content. And so half of American adults over the age of 18 saw the content from these two organizations, which is an enormous achievement. And we know that this worked, and we know that they were impacted through brand lift and through measurement. And so we do, I think, want to also give them a round of applause for this incredible stat and this incredible achievement that they were able to reach just in 1 month alone. So.
I feel like you've also put them, now it's I feel like you might need to even take a bow at a certain point.
So Nick, on that note, we have talked about the amazing success, the amazing impact, how we did it. what comes next, and what are some of your parting thoughts to the audience here?
Yeah, so I'll echo what Lucien said. This was not a playbook that can only live with COVID. This can be adapted for a lot of different public health topics, and the recipe for success for us at Johns Hopkins in the context of COVID, which again, you can scale this to other topics, was we combined several factors. We had access to the data through the map, which a lot of organizations have access to the same amount of data. We had expertise in public health, so we had virologists a phone call away, we had epidemiologists. We also had trustworthiness because we had this known name of Johns Hopkins as a central player in the pandemic response. And then lastly, and I think I want to stress this the most to everyone in the audience who works at a health department, we had content that we iterated, that we optimized for sharing, and that crucially, we only had our faculty look at when it was in the script stage. I did not want epidemiologists weighing in on the color of my designs. I did not want them telling me that this graph looked strange, because the way we are the content specialists, we are the communicators, let us cook. They would not want me evaluating their models for the same reason. So that was the successful recipe that we had. And then, you do that alone on any public health topic, you are going to be set up for success. You do that then by you add on to that leveraging the platforms such as Meta to get that content directly in front of the people who most need to see it, and then it's supercharged. And that's the takeaway.
I agree that let the cooks in the kitchen cook, right? Like that's what we're all here to do. And Tina, what about you from KFF?
Well, I mentioned we started our campaign by looking backwards at the work we were doing in HIV, drew on that, and now we're taking the learnings from this project, taking it forward, and you keep sort of building and adding to that. Having the data from Meta to be able to sort of show the impact is so critical. We know there is never enough money in public health to do all the messaging and what we need to do, and we have to be so economical and focused with it. And so I think that messaging about targeting and really thinking about audience and making content that speaks to the specific audience. One of the exciting things about digital media is that you can do things in a way that gives you so much more ability to kind of really meet people where they are and with what they need in a moment and from the people they want to hear it from. There's been talk too, you need just a wealth of content. We needed a lot of information. We needed diversity. That is what brought the equity in the information we were getting out to. I think we're all passionate about getting out information. I think as we talk about health equity, thinking about access to quality health information is as critical as issues around health care, health coverage, access to the vaccines themselves. And so I hope, a takeaway from this is really seeing sort of the power of communications in advancing these public health goals that we have as well. And, again, I think you can't talk about partnership enough, and when it happens and it works like it did here, that's magic, and you want to keep replicating that because we all came to the table with something that we had a vision to do, and we're able to do it because of that. So that's sort of where we are.
Amazing. This is magic. And maybe to hopefully prove that point, for those of you in the audience, can you raise your hand if on social media you have seen content about COVID from one of these partners in the last 3-ish years? Awesome. And if you haven't yet, it's all still there. We encourage you to check them out, and their work is incredible. And we're just really grateful to have the opportunity to showcase their work and our partnership today. And thank you so much for having us here at the conference, and enjoy the rest of the day. Thanks so much.